Hello, I'm Kathy Amano, and this is my presentation on where I work at Western Maryland Counseling Center. There are two locations in Frederick and Hagerstown, and I'm working at the Hagerstown location. Overall, to describe the goals, objectives, and services and the population served here at WMCC, they provide assessment and treatment of mental health and chemical dependency problems with a professional staff that is highly skilled in caring for adults, adolescents, and children, and is dedicated to serving their special needs and concerns. At WMCC, they provide individual counseling to adults, children, couples, and families from the age of 5 to 105, and they do not discriminate against anyone on the basis of race, religion, gender, age, disability, or sexual orientation. WMCC focused on a strength-based perspective, believing that each individual has the capacity to overcome life's challenges by focusing on the strengths that each client inherently possesses. They emphasize an approach that is client-led, that begins where the client is, addressing problems at their own pace and comfort level. WMCC is a Commission on Accreditation of Rehabilitation Facilities accredited organization, CARF for short, that adheres to comprehensive standards, prioritizes client-focused services, and maintains accountability and transparency in their operations. Achieving and maintaining CARF accreditation reflects WMCC's dedication to providing the highest level of care and continually enhancing its practices. At the Western Maryland Counseling Center, they seek to provide quality behavioral health care with respect, dignity, and cultural sensitivity through the efficient and effective delivery of services. The Western Maryland Counseling Center offers comprehensive community-based behavioral health services to children and adults in Washington and Frederick counties. Historically, the Western Maryland Counseling Center has been in business since March of 2013. They provide assessment and treatment of children, adolescents, and adults with mental health and chemical dependency issues using a community-based model. They deliver services to the client's home, school, workplace, or other community location. Their vision includes the provision of culturally competent, holistic, and wellness-focused services that promote social and emotional development, prevent the development of mental health challenges, and address social emotional problems that currently exist. The highlights include, in 2019, WMCC continued to work on self-improvement, accessibility to clients and stakeholders, and creating a community environment in which to grow. In 2020 and 2021, the WMCC faced significant challenges due to COVID-19 and offered full telehealth services to meet the needs of the clients and the community. In 2022, they opened a second location in Frederick, Maryland to continue to meet the needs in our communities. And in 2023, they continue to offer multiple methods of interaction with clients to meet them where they are, including in-person appointments, telehealth appointments from their homes or our offices, and community appointments. And at this point, WMCC has served at least 600 community members. And this is their treatment process. During the initial appointment, clients can discuss their situation and concerns with a mental health professional. Afterward, an assessment and recommendation for treatment would be made, and follow-up appointments would be scheduled with an individual therapist. WMCC policy requires each client to first complete an intake appointment with a clinical therapist and initiate ongoing treatment prior to scheduling an appointment with a psychiatrist. These services complement one another, and client success depends on regular attendance and participation in therapy, in addition to prescription medications when appropriate. With regard to prescription medications, the WMCC psychiatrist may write prescriptions at the time of a client's initial psychiatric appointment. However, it is important to note that clients must be engaged in therapy in order to receive these services. In terms of their funding sources, WMCC accepts all forms of Maryland Medicaid, including the Red and White Card, United Healthcare, Amerigroup, Priority Partners, and others. Medicare at this time is not accepted. Private pay is also an option. The WMCC in Frederick will be accepting private insurance in the future, but for now only accepts self-pay or provides a super bill for clients to pass on to their insurance provider. Medicaid or state insurance is accepted in Frederick as well. So here are the communities served by this agency. Hagerstown, Maryland is a city located in Washington County with a population of 40,000 residents. Known for its rich history and scenic surroundings, Hagerstown is a regional hub for commerce and transportation, often referred to as the Hub City. The city's demographics include a diverse mix of age groups and ethnic backgrounds. The median household income in Hagerstown is around $45,000, with a mix of urban and suburban living. Noteworthy highlights of the city include its vibrant art scene, historical sites such as the Maryland Theater, and recreational opportunities in nearby parks like the Chesapeake and Ohio Canal National Historical Park. Hagerstown is also known for its well-preserved historic downtown area and the annual Western Maryland Blues Fest, attracting visitors from across the region. Economic hardships remain notable in Hagerstown, Maryland. Hagerstown has a visible homelessness problem with its local shelters and services working to provide support for individuals and families experiencing homelessness. Efforts are ongoing to address this issue through various community programs and initiatives. Poverty rates in Hagerstown are higher than the national average, and the economic disparities contribute to a significant portion of the population struggling with financial instability. Various local organizations are dedicated to providing food, housing assistance, and other essential services to those in need. While Hagerstown has a diverse economy, unemployment remains a concern for some residents. The city has been working to attract new businesses and industries to create job opportunities and stimulate economic growth. Job training and economic assistance programs are also available to help residents gain the skills needed for the current job market. Addressing these issues requires continued community effort and resources to improve the quality of life for all Hagerstown residents. In Hagerstown, economic hardships contribute to significant mental health needs, including higher rates of anxiety, depression, and substance use disorders, particularly among vulnerable populations such as the homeless and low-income families. Community mental health centers like WMCC, nonprofits, school-based services, and crisis intervention teams provide essential support, often on a sliding fee scale. However, barriers such as financial constraints, lack of insurance, and transportation issues limit access to care. Efforts to improve funding, reduce stigma, expand integrated care models, and engaged community are crucial to addressing these needs and ensuring comprehensive mental health services for all residents. These are the relevant social justice issues in Hagerstown. The mental health needs and services in Hagerstown are deeply intertwined with various social justice issues. Key social justice concerns include economic inequality, access to care, homelessness, stigma and discrimination, systemic barriers, and intersectionality, which means the intersection of various social identities, including race, gender, age, and socioeconomic status. These all affect how individuals experience and access mental health care. Recognizing and addressing these intersecting factors is crucial for creating equitable and effective mental health services that cater to the diverse needs of Hagerstown's population. Another relevant social issue is advocacy and policy change. Advocating for policies that increase funding for mental health services, expand insurance coverage, and support integrated care models is vital. Social justice efforts should focus on influencing policy changes that ensure that all residents have access to high-quality mental health care. Addressing these social justice issues requires a comprehensive and multifaceted approach involving community advocacy, policy reforms, and a commitment to equity in mental health care. Ensuring that all individuals in Hagerstown have access to the mental health services they need is fundamental to promoting social justice and improving community well-being. So this is the historical context of social justice issues addressed. Mental health parity is a prominent issue. And regarding mental health parity, WMCC offers greater access to mental health services to the community. Historically, mental health care has been stigmatized, underfunded, and often neglected. In the 19th and early 20th century, individuals with mental health illnesses were often institutionalized in asylums with poor conditions and little treatment. The mid-20th century saw a shift towards deinstitutionalization, intending to integrate individuals with mental illnesses into the community. However, this shift often lacked sufficient community-based services, leading to increased homelessness and incarceration among the population. With the passage of the Mental Health Parity and Addiction Equity Act, MHPAEA of 2008, and the Affordable Care Act, the ACA, improving access and equality in mental health services, community-based mental health services like the WMCC have been able to offer greater access to much-needed mental health services to the community. Equal employment opportunity is also another social justice issue addressed by our agency. The WMCC is committed to ethical hiring practices. The Western Maryland Center is an equal opportunity employer that does not discriminate against any staff or applicant for employment because of race, color, sexual orientation, national origin, or disability for otherwise qualified individuals. So the larger policy issues that impact WMCC at both Hagerstown and Frederick locations in Maryland involves navigating a complex policy environment shaped by local, state, and national discussions. Within its organization, efforts focus on improving insurance coverage. Currently, WMCC can only accept Medicaid, but is actively working to include Medicare clients. They are also working to expand their telehealth services and integrate mental health care with community programs. Statewide, Maryland prioritizes behavioral health integration, Medicaid expansion, and crisis intervention services. And nationally, key policy conversations revolve around reinforcing mental health parity laws, addressing the opioid epidemic through integrated care, expanding telehealth access, and developing the mental health workforce. These coordinated efforts aim to ensure accessibility, adequately funded, and comprehensive mental health services for all. So the professional roles at WMCC include a case manager that assists clients navigate complex systems of care, ensuring they receive comprehensive, coordinated, and continuous support. There's also a licensed clinical social worker with advanced clinical training. The LCSWCs conduct psychotherapy, diagnose mental health conditions, and develop treatment plans. There are also social workers that provide counseling and support to individuals and families dealing with mental health issues. They offer therapy, coordinate care through case management, and connect clients with resources such as housing and financial assistance. There's also psychiatrists within the staff. The WMCC psychiatrist is a medical doctor specialized in mental health who diagnoses and treats mental disorders. They conduct comprehensive assessments and prescribe and manage medications and develop individualized treatment plans. The topic areas that require further exploration include access to services, for example, the barriers to accessing mental health services or strategies to improve outreach and engagement with underserved populations. Also, integration of care, which involves better integration of mental health services with primary care, substance use treatment, and social services. Effectiveness of interdisciplinary team approaches is also critical. And finally, effectiveness of treatment modalities that includes outcomes of different therapeutic approaches and comparison of in-person versus telehealth services. Community-based programs also require further exploration, and that would involve looking into the impact of community-based mental health programs on client outcomes. and researching the availability and utilization of resources such as housing, employment, and educational support. Crisis intervention and prevention is key, especially when offering effective crisis intervention strategies or developing prevention programs to reduce mental health emergencies. And finally, workforce development is also a good topic for further exploration, and it involves looking into training needs and professional development opportunities for staff, as well as staff retention and job satisfaction. So these are questions that require further exploration. With regard to access to services, a good question asked could be, what are the main barriers that clients face in accessing mental health services, and how can they be addressed? Or how can the agency increase outreach and engagement with minority and low-income populations? With regard to integration of care, questions are, how effective are current interdisciplinary teams in providing integrated care, and what improvements can be made? Another question is, what are the best practices for integrating mental health services and other health and social services? With regard to community-based programs, a good question to ask is, what impact do community-based mental health programs have on client outcomes? And how can the agency better utilize community resources to support clients' holistic needs? Regarding client satisfaction and feedback, what do clients identify as the strengths and weaknesses of the services provided by the agency? And how can the agency incorporate client feedback to improve service delivery? Regarding funding and resource allocation, how does the current funding structure impact the agency's ability to provide services? And what additional funding opportunities are available, and how can they be secured? And that's it for me. Thank you.